How quickly does follicular lymphoma progress?
In general, it's usually a slower growing disease, so it does not progress very quickly. It can take years sometimes. There are different forms, though, just as I discussed. So you might have a more aggressive form or a higher grade follicular lymphoma that can grow more quickly. But most follicular lymphomas are typically a slow growing disease that take years to progress.
Yeah, so how quickly follicular lymphoma progresses really depends on the individual case, and to some degree, things like the grade and what the previous history is, and those kind of things. The other thing we think about is whether it transforms or sort of mutates to a more aggressive form of lymphoma, which is usually a large B cell lymphoma. All of those factors, dictate how quickly it progresses. There are some things that we can use in the clinic, some things like laboratory testing, understanding this, the stage, the age of the patient can be features that help us kind of predict those things. People have started to use even genetic sequencing, like like some of these next generation sequencing platforms that we can understand the genes mutated and that are driving the follicular lymphoma. All of those things are imprecise because there are patients that we find some things that are maybe adverse prognostic markers, and the follicular lymphoma behaves growing very slowly. And I've even had, many patients that will have a lot of their lymph nodes that may be enlarged at diagnosis or at some point in their disease actually go away and shrink on their own, which I think gets back to some of the ideas of immune environment and some of these things we're working on in terms of treatments. So that can be very hard to predict. And then again, the other thing with follicular lymphoma is there's a lot of variability in cases, even though on average, most of these are very slow growing or indolent. And we really try to, we try to, observe or do as little treatment for those folks as possible.